I love when I get questions about the work that we're doing at Tammy Dowley-Blackman Group. Tammy Dowley-Blackman Group is made up of three brands, including TDB Group Strategic Advisory. And some time ago, we started actually trying to answer these questions about the work we do and what we call these green case studies. We named it that because green is the color of the environment and renewal and expansion and transformation. And that's certainly the work that we get an opportunity to do that we're really proud of and really are grateful that we get to do. In this particular instance, we were asked to do this work with Corewell Health. Corewell Health is based in Michigan and has about 60,000 team members working across the state. And it's actually a merger in 2022, a merger of multiple health conglomerates to create Corewell Health. And the work we've been doing there has actually been multifaceted. We are working very specifically with Corewell Health West, Healthier Communities. And in this, we're working with a team that is trying to think about not only how you center health equity, how we make for healthier communities generally, but they're also trying to still work through an integration process. And those of you who've done integration know that it is not something that is easy on a great day, and certainly not easy coming out of COVID. And you can have incredible people, as certainly Corewell Health has, and it still just takes time to really to do integration well. And so Corewell Health West and the Healthier Communities team, which is led by Vanessa Briggs, it really has been trying to understand not only their work, and they're doing an audit of their work because they don't want to assume that what they did 2 years ago, 4 years ago, is still the way they should be doing the work. But then they're also asking questions about how they can work collaboratively with other teams, service lines across the nonprofit health system in Michigan. So the work we're doing is helping the management team figure out how it's going to work even more cohesively. And so helping them to think through a management team charter, helping them to think about their dynamics of their work, helping them to utilize tools that are internal to Corewell Health, but also helping them to think about how they're going to bring the voices of so many other people who are in Corewell Health West into the process of helping to think about strategic directions, their new strategic direction. And so at its center, the work isn't changing. They're a healthcare entity. They care about their patients across Michigan. They want their patients to receive the highest quality of health care and attention. None of those things are changing. They're simply just asking questions about how can we do this work even better? How can we better support team members? And how can we as a management team ask ourselves better questions? And how can we create greater accountability? And so we've been doing that work, helping them to look at their key performance indicators, helping them to think through again what that management team process should look like, and helping them to interview across all of these other service line leaders and departments to better understand what those departments are doing for lessons learned that could come back into healthier communities, and also sharing things that healthier communities have been doing so it can be helpful to their colleagues that they collaborate with across other service lines. We work across corporate, government, nonprofits, and foundations, and have worked with other healthcare entities. And so we understand that this work is the same. You need good infrastructure, you need good systems, you need team members to be on the same page, you need trust, you need psychological safety, you need people to feel confident and competent, you need people to be able to ask questions. And that's what we're helping them to be able to develop even more and to think about their strategic direction going forwards by understanding the work they've done before. So it is wonderful to be in partnership with Vanessa Briggs. It is wonderful to be in partnership with her management team. And it has really been wonderful to get to meet so many talented people across Corewell Health who are working their hardest to make sure that residents of Michigan get the best health care possible. We never take it lightly about the work that we get to do, and always learning, and we're always trying to bring new tools, new skills, and are listening deeply and attentively around what is needed so that we can bring that to the forefront. So that's what we're doing at Corewell Health. Thank you for the questions, and it is going well.